procedures we do to stabilize the back. When you look at the spine, ideally the spine has to be stable. If the spine is not stable, you're going to get pain and you're going to get other neurological symptoms. When you have instability of the spine has to be stabilized. And the stabilization, it can be surgical stabilization. Then we also have conservative. What patients have to know, or what the public has to know, that when we stabilize your spine, you lose some level of mobility of the spine, because by stabilization, we fuse a segment. But God created us in such a way that we must have movement in the back. So when you fuse a segment, the adjacent segments are going to do more work to compensate for the loss in motion in this particular segment. This also can cause a problem. Now, when we are doing the stabilization, we use implants. We use what we call pedicle screws. Now, whenever we do this, we also do bone grafting. And by bone grafting, we get small pieces of bone from other parts of the vertebrae, and we put them in between the bones, with the hope that during the healing, this bone fuses so that it's like one block, so that even if later on in life the patient gets problems with these implants, or if they demand that they want the implants out, you remove them, at least you leave a stable back. We also have what we call spondylolisthesis. This is a situation whereby most patients get a small fracture of the spine. So we have, abnormal translation or displacement of vertebrae. So what I would like you to know, we offer quite a number of medical services in Uganda, especially for the spine. The people have to know that these services are available in the country. They are available both in the public and the private hospitals. All you need to know is where to get them.